Governor Beshear says Kentucky needs to do a better job of vaccinating the state's minority communities after new data shows inequities in the vaccine rollout so far. LEX 18's Catherine Collins explains his plans to change this going forward. It's a problem that with many different causes.
In Kentucky, just 4.3% of COVID-19 vaccines have gone to African Americans.
That's not acceptable.
Governor Beshear says that number needs to be closer to 8%, the share of the population African Americans make up. And he says just 1.1% of vaccines have gone to the state's Hispanic population.
This is about being intentional.
He's announced outreach programs to help with vaccine hesitancy.
And I admit when I first heard about them, I thought, okay, well, I'm going to wait and see what happens.
Especially in the Black community, where past unethical treatment like the Tuskegee syphilis study has caused distrust of medical professionals. Governor Beshear says people need to hear from those they trust. He invited faith leaders to receive the COVID-19 vaccine and encourage others to do the same.
This is the first step out of this global pandemic.
But he says some of the inequity in vaccinations comes from larger societal issues. The first professions to receive the vaccine have been healthcare workers, first responders, and school staff. Governor Beshear says there need to be active efforts to hire minorities in those fields.
We've got to admit that 1A and 1B and the way that they were set up shows us a larger problem that we have to work on if we want to have that world that I think we're all committed, or I hope we're all committed, or we should all be committed to building.
He says equity needs to be a driving force of Kentucky's vaccine effort going forward. In Frankfort, Catherine Collins, LEX 18 News.